So why is this important? Heroin use has increased 63% in 11 years from 2002 to 2013. The CDC shows that there's also an increase in heroin-related deaths. One article states that there's a 286% increase in heroin-related overdosing between these years. In 2013, over 8,200 people overdosed from this drug, and roughly about 517,000 people in the U.S. report having used heroin or had a drug dependence because of it. Even presidential candidates are talking about this drug in their campaign platforms. Hillary Clinton is quoted as calling it the quiet epidemic. So who becomes a heroin addict? In the most recent years, there has been a change in the user. In the early 2000s, it was more common for Black Americans aged 45 to 64 to have more deaths related to heroin. In 2013, you can see that the who is changing. It's now more prevalent for non-Hispanic white males aged 18 to 44 to have more deaths related to heroin. Every age is affected by this drug. The graph shows you that there's a steep incline from 2010 to 2013 with deaths involving heroin. In Indiana, Kentucky, and West Virginia, there have been a steady increase in the outbreaks of HIV and hepatitis. You can see in this graph that in the Midwest and New England have seen a greater increase in heroin-involved deaths in most recent years. In 2015, between the months of December and March, there were 71 reported new cases of HIV in Indiana related to intravenous drugs. There are many risks involved with using an intravenous drug like heroin. It's highly addictive, the purity is unknown, and it's constantly changing. Using needles increases the risk of diseases such as hepatitis, HIV, as well as vascular diseases. Are there other factors that play into heroin addiction? How tightly does prescription drug abuse play a role in the use of heroin? A 2011 study found that of heroin injectors, 40% reported being addicted to opioids before transitioning into heroin. It's also found that 1 in 20 Americans aged 12 and older have reported using painkillers for non-medical use. The CDC reports that using other drugs puts you at higher risk for becoming addicted to heroin. Those addicted to painkillers are 40 times more likely to become addicted to heroin compared to those abusing cocaine are only 15% more likely to become addicted to heroin. In 2010, in 1 month, the amount of prescriptions written for painkillers is said to have been able to medicate every American 24/7 for an entire month. Remember, heroin is cheaper and doesn't require a prescription. The next video is going to be of Dr. Cortad. She has a background working in drug clinics in Massachusetts and is very knowledgeable about this topic.
My name is Dr. Kirsten Cortade, and I'm currently the Chief Medical Resident at Newton Wellesley Hospital and a Senior Resident at MGH. And what we're talking about is, what role do doctors play in the opiate epidemic and the increased deaths from heroin? And I think that a lot of people wonder, is this caused by doctors? And so I was recently looking into the literature and found that as the prescriptions for narcotics go up, especially oxycodone, so did the number of deaths and so did the number of admissions for addiction to opiates. So certainly there is some link between increased prescribing and increased deaths. And so recently I was reading a study, it was in JAMA Psychiatry, and it was saying, when people start using heroin, what was the first drug? Like when they picked up opiates, what was the first thing they used? And back in the 1960s through 1980s, the first drug they used was really heroin. So they went out to the street and they bought heroin. But since the 1990s, that has changed to prescription opiates. So when people are first introduced to narcotics, nowadays it's more likely to be prescription opiates. Whether that's from a doctor or from a family member is not clear in the study, but what we know is things have changed. It's not the same as it used to be. People used to go get heroin and that is what happened, but now really they're being introduced to prescription narcotics, and then when they don't have access to those anymore are changing to heroin. So there is a link between what we do, what we prescribe, what we give people, and their chance of dying from a heroin overdose. And I think that recently that's been looked into in the state of Massachusetts more closely, with a new law coming out only a month ago trying to limit the amount of narcotics doctors can give patients. I think that might help. I think it's only a small step because, as you know, it's a very complex problem. Doctors aren't the only factor in the problem, but I think that doctors might be the easiest part to control, to regulate. They're a very regulated group anyway, and so kind of looking in on that and trying to figure out what we can do as a group of educated individuals to help.
So what does all this information mean? The heroin epidemic is real. You can buy a bag of heroin for less than a six-pack of beer. And while male millennials are at the greatest risk, it's clear that this touches all ages and all socioeconomic groups. Risk of suicides related to this epidemic and failed rehab attempts have increased. There's also an increased strain on the court systems and emergency rooms dealing with an increased population using and becoming addicted to this drug.